So what if you're 25, 30 and you have a frozen shoulder? So my guess is if you're 25 or 30, what is causing your frozen shoulder? It would be more likely to be a secondary frozen shoulder. Odds are good there is an underlying injury that is happening. It is not uncommon that people could have a slap tear, a labral tear in their shoulder, a rotator cuff tear, something along that line. And that initial pain could have caused somebody to have a limited motion, and you stopped using that shoulder because you're no dummy. You know, when I move my arm that way, it hurts. So then it can freeze down and get adhered and tight. So oftentimes when I see people that have frozen shoulder at a young age, it's a secondary frozen shoulder because there is another underlying problem. And a majority of these people do eventually end up having an MRI to see what soft tissues are being irritated. And this could be things such as muscles, like the rotator cuff. There could be a bursa issue. There could be the labral, which is the kind of like the meniscus, but of the shoulder. And sometimes there is a fracture where maybe somebody had a fall on an outstretched arm. Any of these things are exceptionally painful. And when you have this happen, you're not going to want to move your arm, and then it's going to become fibrotic and get tight and not move. And then this is when getting a good diagnosis, seeing an orthopedic doctor, and finding out what the real root cause is makes all the difference.